Dementia doesn't happen overnight. It starts with small changes, so small you might dismiss them as normal aging. But catching dementia early can make a huge difference in slowing its progression. In this video, we're covering the most common early signs of dementia, signs that doctors and researchers have identified in people before their symptoms became severe. If you or someone you love is showing these signs, don't panic, but do pay attention, because recognizing these symptoms early gives you time to take action. Let's get started. Sign number 1, memory problems that disrupt daily life. We all forget things sometimes, but dementia-related memory loss is different. It's not just forgetting where you put your keys, it's forgetting what the keys are for. People with early dementia often ask the same question repeatedly, even minutes apart. Forget recent events but clearly remember things from decades ago. Struggle to recall important names, dates, or conversations. For example, if someone forgets an appointment but remembers it later, that's normal aging. But if they completely forget the conversation ever happened, that's a warning sign. Sign number 2, difficulty with planning or problem solving. Does balancing a checkbook suddenly feel impossible? Is following a recipe, one they've used for years, now confusing? Early dementia can make everyday tasks much harder. People may struggle to follow step-by-step instructions, have trouble keeping track of bills and expenses, make unusual mistakes in familiar tasks. If someone who used to be great at organizing suddenly gets overwhelmed by simple planning, it's worth paying attention to. Sign number 3, confusion with time or place. Ever walk into a room and forget why? That's normal, but people with early dementia may forget where they are, how they got there, or even what day, month, or year it is. They may lose track of time, even on familiar routines. Get confused about where they are, even in well-known places, forget the reason they left the house, or how to get back home. This can make them feel disoriented or anxious, especially in new environments. Sign number 4, trouble speaking or finding the right words. Pausing to find a word happens to everyone, but with early dementia, this happens frequently and disrupts conversations. Signs include struggling to follow or join conversations, stopping mid-sentence and forgetting what they were saying, calling objects by the wrong names, like saying hand clock instead of watch. They may also repeat themselves often because they don't remember saying something earlier. Sign number 5, personality and mood changes. Dementia doesn't just affect memory, it can change someone's personality too. You may notice mood swings, going from happy to irritated quickly, increased anxiety, depression, or paranoia, a loss of interest in social activities or hobbies. Someone who was once outgoing may become withdrawn and easily frustrated. This can be especially hard on family members who don't recognize the person they once knew. Sign number 6, poor judgment and decision-making. Would your loved one normally never fall for a scam, but now they're giving away money to telemarketers? Have they stopped caring about personal hygiene? Dementia affects judgment, leading to reckless spending or falling for scams, wearing inappropriate clothes for the weather, making uncharacteristic or risky decisions. If someone who was always careful suddenly starts making poor choices, it could be an early sign of cognitive decline. Sign number 7, trouble recognizing people or objects. Another warning sign, struggling to recognize familiar faces or everyday objects. They may have trouble identifying friends and family members, confuse people, calling them by the wrong name, not recognize themselves in the mirror. This can be deeply distressing for both the person and their loved ones. Final thoughts. If you've noticed these signs in yourself or someone you care about, don't ignore them. Early detection matters. The sooner dementia is diagnosed, the more can be done to slow its progression and improve quality of life. Talk to a doctor if you recognize multiple symptoms. Encourage brain-healthy habits, good sleep, a balanced diet, social engagement, and mental stimulation all help. And most importantly, be patient and supportive if you're helping a loved one through this journey. If you found this video helpful, subscribe, and share to help others stay informed. Thank you for watching and take care of your mind. Love.